Do you often feel tired for no reason, or notice strange tingling or burning sensations in your hands and feet? Maybe it's that annoying numbness that comes and goes, or even persistent pain that's hard to explain. These symptoms are more than just an inconvenience. They could be signs of something serious, nerve damage or neuropathy. While many people know about vitamin B12's role in nerve health, there's one overlooked vitamin that's just as crucial: vitamin B1, also known as thiamine. Surprisingly, a deficiency in this powerhouse vitamin can wreak havoc on your nervous system, causing or worsening the very symptoms you might be brushing off. In this video, we'll dive into the critical role vitamin B1 plays in protecting your nerves, how a deficiency impacts your health, and why addressing it could be the key to reversing pain and discomfort in your hands and feet. Let's uncover the facts. What is vitamin B1? Vitamin B1, or thiamine, is a vital nutrient your body relies on to keep its most essential systems running smoothly. Often referred to as the energy vitamin, B1 plays a crucial role in converting the carbohydrates you eat into ATP, the energy your cells use to power everything from muscle movements to brain activity. Without sufficient thiamine, your body struggles to produce energy efficiently, leaving you feeling fatigued and out of sync. Beyond energy production, vitamin B1 is indispensable for your nervous system. It helps maintain the health of your nerves, acting as a protective barrier against damage that can lead to tingling, burning sensations, or even neuropathic pain. Thiamine is also key for cognitive health, as a deficiency can contribute to memory problems, difficulty concentrating, and an overall decline in mental sharpness. The benefits of B1 extend to your heart as well. This vitamin supports proper blood circulation and helps prevent heart-related issues by ensuring that your cardiovascular system functions optimally. It contributes to the healthy contraction of heart muscles, playing a direct role in maintaining your heart's strength and efficiency. In short, vitamin B1 is a multitasking powerhouse that supports energy production, protects nerves, sharpens cognitive function, and strengthens your heart. Yet, it's often overlooked, despite being just as essential as other well-known vitamins like B12. By understanding its importance and ensuring you get enough through diet or supplementation, you can support your body's overall health and vitality. Causes of vitamin B1 deficiency. Vitamin B1 deficiency is more common than many people realize, and its causes often stem from everyday lifestyle choices, medical conditions, or specific dietary habits. Let's break it down. First, lifestyle factors play a significant role. Excessive alcohol consumption is one of the primary culprits. Alcohol not only reduces the absorption of vitamin B1 in the intestines, but also speeds up its elimination from the body, leaving chronic drinkers at high risk. Additionally, diets heavy in processed foods like white rice, white bread, and refined pasta can contribute to deficiency, as these foods are stripped of their natural thiamine content during processing. Certain medical conditions also increase the likelihood of developing a vitamin B1 deficiency. For instance, diabetes can cause your body to excrete more thiamine through urine, while diuretics, commonly used to manage high blood pressure or swelling, also enhance the loss of B1. Dialysis, often a necessity for patients with kidney disease, further accelerates thiamine depletion by removing it directly from the bloodstream. Dietary habits can also interfere with thiamine levels. High consumption of tea or coffee introduces thiaminases, enzymes that break down vitamin B1 in the body. Similarly, eating raw fish or consuming foods preserved with sulfites can inhibit thiamine absorption, creating an added barrier to maintaining healthy levels. Surgical factors can lead to thiamine deficiency. Procedures that affect the digestive system, such as gastric bypass surgery, reduce the surface area for nutrient absorption, making it harder for the body to take in enough B1. These surgical changes often necessitate lifelong supplementation to avoid nutrient imbalances. Understanding these causes highlights just how interconnected our daily choices and health conditions are with maintaining adequate vitamin B1 levels. Identifying and addressing these risk factors is key to preventing deficiency and its potential complications, particularly for nerve and energy health. Symptoms of vitamin B1 deficiency. The symptoms of vitamin B1 deficiency can creep up gradually, often going unnoticed until they start interfering with daily life. Recognizing the early signs and understanding how this deficiency impacts your body is crucial for addressing the issue before it worsens. In the early stages, vitamin B1 deficiency may manifest subtly. You might experience irritability, an unexplained loss of appetite, or mild memory issues. These signs are easy to overlook or attribute to stress or fatigue, but they can signal that your body is struggling to get the energy it needs for optimal function. As the deficiency progresses, neurological symptoms often become more prominent. Neuropathy is one of the most common signs, characterized by pain, tingling, or numbness in the hands and feet. For some, these sensations can escalate into a burning pain that's hard to ignore. Tremors, or uncontrollable shaking in the hands or other body parts, may also develop, indicating that nerve function is being compromised. Cognitive issues can appear as well, including feelings of anxiety, depression, or difficulty concentrating, symptoms that can significantly impact mental clarity and emotional health. Physical symptoms of a vitamin B1 deficiency are equally distressing and can disrupt everyday activities. Restless leg syndrome, marked by an uncontrollable urge to move the legs, often surfaces, particularly at night, leading to sleep disturbances. Burning sensations in the extremities are another hallmark symptom, frequently accompanied by dizziness or balance problems that make movement challenging. Some individuals may even notice vision problems, as thiamine deficiency can impact the nervous system's connection to the eyes. Together, these symptoms paint a picture of how integral vitamin B1 is to nerve, brain, and overall physical health. Left unaddressed, a deficiency can severely impact quality of life, underscoring the importance of early detection and appropriate action. Understanding these signs can help you connect the dots and take steps toward restoring balance to your health. Severe consequences of B1 deficiency. When vitamin B1 deficiency becomes severe, it can lead to debilitating conditions with profound impacts on the body. The consequences can be life-altering, affecting the nervous system, cardiovascular health, and even brain function. Among the most recognized conditions linked to severe B1 deficiency are beriberi and Wernicke-Korsakoff syndrome. Beriberi is a disease that presents in two distinct forms, each targeting different systems in the body. Dry beriberi primarily affects the nervous system. Individuals may experience burning sensations in their feet, muscle weakness, and a gradual loss of motor coordination, which can make simple movements increasingly difficult. This form of beriberi highlights the critical role of vitamin B1 in maintaining healthy nerve function and energy production for muscles. On the other hand, wet beriberi impacts the cardiovascular system. It often starts with fluid retention, leading to swelling in the lower extremities, and can escalate to serious heart problems, including heart failure. Wet beriberi underscores how thiamine is vital for maintaining proper heart function and blood circulation, as a lack of it disrupts the body's ability to use energy efficiently. Wernicke-Korsakoff syndrome is another severe consequence of vitamin B1 deficiency, closely associated with chronic alcoholism. The condition initially manifests as Wernicke's encephalopathy, which is marked by confusion, difficulties with eye movements, and problems with coordination and walking. These symptoms are the result of thiamine's critical role in brain function and its depletion due to alcohol's interference with absorption and storage. If left untreated, Wernicke's encephalopathy can progress to Korsakoff syndrome, a chronic and debilitating condition characterized by severe memory loss and irreversible brain damage. People with Korsakoff syndrome may lose the ability to form new memories, making it challenging to live independently. This progression highlights the importance of addressing thiamine deficiency early to prevent long-term neurological damage. These severe outcomes of vitamin B1 deficiency demonstrate the essential role of thiamine in maintaining the body's most critical functions, from nerve health and muscle strength to heart performance and brain integrity. Recognizing the signs and seeking treatment can be life-saving. Diagnosing B1 deficiency. Diagnosing vitamin B1 deficiency requires a combination of clinical observation and laboratory testing to confirm the root cause of symptoms. A thorough physical examination is often the first step. During this evaluation, a healthcare professional looks for signs such as behavioral changes, difficulty concentrating, or unexplained irritability. Movement issues, such as tremors, muscle weakness, or coordination problems, may also provide critical clues. These physical manifestations often hint at underlying neurological or cardiovascular complications tied to thiamine deficiency. To confirm the diagnosis, blood tests play a pivotal role. One of the most specific methods is the transcedulase activity test, which measures the function of an enzyme dependent on vitamin B1. This enzyme is critical for energy metabolism, and its reduced activity can strongly indicate thiamine deficiency. Additionally, blood tests may assess overall thiamine levels directly, helping to pinpoint whether symptoms are linked to a nutritional gap or another underlying condition. Together, these diagnostic tools provide a comprehensive picture of how vitamin B1 deficiency is impacting the body. Early detection is essential, as it allows for timely intervention and prevents the deficiency from progressing to severe conditions such as beriberi or Wernicke-Korsakoff syndrome. Treatment for vitamin B1 deficiency. Treating vitamin B1 deficiency typically involves a combination of supplementation and lifestyle adjustments to restore thiamine levels and address the root causes. The cornerstone of treatment is thiamine supplementation, which can be administered in different forms depending on the severity of the deficiency. For mild cases, oral supplements are usually sufficient and easy to incorporate into a daily routine. In more severe cases, such as those involving beriberi or Wernicke-Korsakoff syndrome, thiamine may be given through injections to ensure rapid absorption and immediate effectiveness. These treatments are highly effective in replenishing the body's thiamine reserves and alleviating symptoms. Alongside supplementation, dietary adjustments are crucial for long-term management and prevention of recurrence. Addressing lifestyle factors that contribute to the deficiency is often the first step. For instance, reducing or eliminating excessive alcohol consumption is critical, as alcohol impairs thiamine absorption and depletes its stores. Similarly, cutting back on processed foods like white bread, rice, and refined carbohydrates can help, as these foods lack thiamine and may displace nutrient-rich alternatives in the diet. Incorporating thiamine-rich foods, such as whole grains, legumes, nuts, seeds, and lean meats, ensures a more balanced intake of this vital nutrient. Together, supplementation and dietary improvements form a comprehensive approach to treating vitamin B1 deficiency effectively. Prevention strategies. Preventing vitamin B1 deficiency starts with maintaining a balanced diet that includes a variety of nutrient-dense foods rich in thiamine. Key sources include pork, beef, and organ meats, which are excellent for boosting thiamine intake. For plant-based options, whole grains like brown rice, oats, and quinoa are fantastic choices, as are legumes, including lentils and black beans. Nuts and seeds such as sunflower seeds and flax seeds, along with green vegetables like spinach and asparagus, also provide significant amounts of thiamine. Brewer's yeast, often used as a dietary supplement, is another potent source of this essential vitamin. Lifestyle adjustments are equally important for prevention. Reducing or eliminating excessive alcohol consumption is critical, as alcohol not only depletes thiamine but also interferes with its absorption. Similarly, moderating intake of tea and coffee can help, as these beverages contain compounds that break down thiamine in the body. Focusing on fresh, whole foods over processed options is another effective strategy to ensure a consistent intake of thiamine. Certain groups require extra attention to their thiamine levels. Pregnant and breastfeeding women have higher nutritional needs and must prioritize thiamine-rich foods or supplements. Diabetics, who are prone to increased thiamine excretion, may benefit from monitoring and supplementation to avoid deficiency. By combining a nutrient-rich diet with mindful lifestyle choices, you can protect yourself from vitamin B1 deficiency and its associated health risks. Vitamin B1 is a cornerstone of good health, essential for maintaining proper nerve function, supporting a healthy heart, and preserving cognitive well-being. From preventing neuropathy and burning sensations in your extremities to reducing the risk of serious conditions like beriberi and Wernicke-Korsakoff syndrome, its importance cannot be overstated. Yet, B1 deficiency often goes unnoticed, with symptoms like fatigue, irritability, or tingling sensations dismissed until they worsen. By recognizing the early signs of deficiency and addressing them promptly, you can protect yourself from more severe health complications. Start by incorporating B1-rich foods, like whole grains, legumes, nuts, seeds, and lean meats, into your daily meals, while reducing alcohol, tea, and coffee consumption to improve absorption. If symptoms persist, consult a healthcare professional for testing and supplementation options. Your health is in your hands. Take action today to ensure your body has the thiamine it needs to thrive.